Hello everyone and welcome back to the Awesome Physio YouTube channel. So today is the last video of our pregnancy series. So we are going to be going through a full 5-minute routine to help you stretch and move the body as women are moving through pregnancy. So looking into the 3rd trimester typically, obviously as we're getting near the end of the pregnancy is where the body is feeling that tension and tightness the most. So we're going to be going through a guided routine, really nice, simple, easy exercises to do to keep the body moving, hopefully release some of that tension and tightness that has formed, and something that you can add in regularly during your 3rd trimester. So for the first 30 seconds, we want to move into a cat-cow position. So this is one of my favourite movement and stretching exercises for women in that 3rd trimester, as it helps to decompress some of that tension into the lower back, as well as allowing movement through the whole of the spine. So from the lumbar spine all the way up to the cervical spine. Obviously, clearly I have no bump in this video, so of course as you're going into that extension and flexion, we're looking at quality not quantity, so you might not be exaggerating it as much as the movement. And then we want to move side to side. So again, the reason why is obviously as the bump is getting bigger and that centre of gravity is moving forward, we get a lot of tightness into the side of the flanks, down into the QL, into your latissimus dorsi muscle. So it's really important to stretch and move through the side of the body, as well as obviously moving up and back into the spinal movements. Once you've done this and we've moved side to side, the next 30 seconds we want to look at some pelvic tilt. So this is where we're holding the core tight and you're bringing the pelvis up towards you. So imagine you're tipping the pelvis underneath you as if you're trying to almost kind of crunch into the tummy. So imagine you're bringing up the pelvis towards that belly button. So you want to aim to do this lovely, slow and controlled, and we're aiming to hold this for 30 seconds. So move, for 30 seconds, holding for 1 to 2 seconds on end range, and then relaxing through. Once we've moved and stretched through the spine and the side of the body, it's then really important to move through the pelvis. So again, we're going to look at abduction initially. This is a great way to move the pelvis side to side, as well as building up those big kind of side glute muscles into glute medius and minimus to add that extra support into the side of the pelvis. So again, we want to aim to do this lovely, slow and controlled, holding for a second on end range and then relaxing down. So again, aiming to do this for 30 seconds. Next, we're going to be doing circumduction of the hip joint. So of course, you're going to be limited on how high you can lift the leg up due to the bump position, but we want to get some movement through the hips because it's really normal with the uterus enlarging and the pressure building around the tummy that we're not necessarily moving the hips. So you can either do this lying on your side or standing, whatever feels more comfortable. We're going to do 30 seconds on one side, and then you're going to switch sides and go back to that hip abduction for 30 seconds. And then we're going to move into the circumduction after this for the following 30 seconds. It's all about strengthening around the pelvis, moving around the pelvis, adding in that extra movement. And again, you can do this standing if it's too uncomfortable on your side. Next, we're moving into a seated position. So we're going to look at stretching through the body. So we want to take this stretch even further. So we want to open up through the side of the ribs, stretching into the latissimus dorsi, aiming to hold this for 30 seconds on one side. And this is absolutely fantastic for opening up through the body. Again, we're looking at quality, not quantity, so never force the stretch. And once you stretch 30 seconds on one side, you're going to gently unwind the stretch and then move on to the opposite direction. So really important to stretch through both sides of the body to allow the optimal movement. finally we're stretching through the neck, because again, as we know, if everything's dropping forward and the bump's gone forward, everything's very tight, it's really normal to get that tension into the neck. So what we're going to do is gently pull the head away to one side, holding for 15 seconds on one side, and then swapping hands and stretching on the other side, and again repeating this routine in the mornings to get the body stretched and moving.